Understanding why children develop the way they do can help us make informed decisions about their future health and growth. Many parents first notice crowded teeth. Others notice mouth breathing, restless sleep, or concerns about facial development. What many don't realize is that these concerns can often be connected. The teeth are often the first thing we notice, but they may be telling us a much bigger story. Researchers have found that severe crowding and narrow jaws were much less common in traditional populations. Our genetics haven't changed dramatically in just a few generations, but our environment has. So the question becomes, what changed? Children today are growing up in a very different environment than previous generations. Softer diets, less chewing, more allergies and congestion, more mouth breathing, changes in posture and lifestyle. None of these factors are necessarily harmful on their own. But together, they create a different environment for a growing child, and the body responds to that environment. The remarkable thing about the human body is that it is always adapting. The body's first priority is survival. If breathing through the nose becomes difficult, the body finds another way. The mouth opens, the tongue drops, posture changes. These are not mistakes. They are adaptations. The body is choosing breathing over ideal growth. And when those adaptations continue throughout childhood, growth may begin to follow those patterns. The body will always choose breathing over ideal growth. Children naturally develop habits and patterns. Bottle feeding, pacifier use, thumb sucking, mouth breathing. These habits are common and do not mean something is wrong. But when repeated over time, they can influence how the face, jaws, and teeth develop. Small habits, big influence. Genetics provide the blueprint. Function provides the instructions. Breathing, chewing, swallowing, tongue posture, these activities occur thousands of times a day. One of the most important influences is the tongue. When the tongue rests against the roof of the mouth, it helps support healthy development of the upper jaw. And because the roof of the mouth is also the floor of the nose, facial development and breathing are closely connected. The tongue doesn't make the face grow, but it helps guide where growth occurs. One of the most important principles in development is that function shapes structure. The body adapts to the way it is used. Breathing, tongue posture, swallowing, chewing. These activities occur thousands of times a day. Over time, growth adapts to those patterns. The teeth are often the last thing we notice. The changes in function usually happened years earlier. If function helped shape the problem, could function also be part of the solution? Growth happens every day. Small influences early in life can create larger differences over time. This doesn't mean every child needs treatment, but it does mean that growth is happening right now. The earlier we recognize factors that may be influencing development, the greater the opportunity we have to support healthy growth. Growth is easier to guide than it is to correct. As the face develops, the airway develops with it. During sleep, children can no longer compensate as easily as they do during the day. This is why healthy facial development is so important. When sleep quality is affected, children often don't look tired the way adults do. They may snore, grind their teeth, sleep in unusual positions, struggle with focus, behavior, or emotional regulation. Often, the signs of poor sleep show up during the day. This is why we look beyond tooth alignment alone. We ask, how is the child breathing? How are they sleeping? Where does the tongue rest? Are their habits affecting growth? Our goal is not simply straighter teeth. Our goal is to support healthy growth, healthy function, and healthy development. We've explored how breathing, sleep, oral habits, and growth are connected. Our goal is not perfection. Our goal is to help children breathe well, sleep well, grow well, and reach their fullest developmental potential.